Dr. Nada, when it comes to appendicitis treatment for children, especially when it comes to surgery, there are two typical options available to parents, right? You've got open surgery and you've got keyhole surgery. So could you share with us what are the key differences between keyhole and open, and how does keyhole benefit the child?
So let me explain firstly about open versus keyhole surgery. Open surgery will involve a cut just over the appendix. So the appendix is on the right hand side here, lower tummy, and the cut can be anything between 2 to 5 centimeters this big. So the process of getting access to the appendix will involve cutting the skin, the fat layer, the muscle layer, and straight into the tummy. The view of the appendix is directly over the appendix from here, and basically what happens during the process of the operation is that the surgeon will deliver the appendix out through that wound and then tie off the bottom part of the appendix and take it off. The issue about that is that the access may be limited, especially if they've got a full tummy, as in a more fatter child, you got more fat, or if there is other issues, the appendix is stuck to other structures, or the appendix is burst, whereby there is pus spillage around the structure, around the appendix, or throughout the tummy. So you need greater access in that situation. In terms of laparoscopic surgery, you place a camera into the belly button, into the tummy, where you can view anything from below the pelvis right up to below the diaphragm. So you got a 360-degree view of the whole tummy, and then you place two other instruments to do the operation with. The current technology of keyhole technique is we have fantastic cameras, and the image that we see on the screen is 4K or even 3D, and we get very precise surgery because you got such a good view. And if there's any problems with the appendix, or if the appendix is really stuck, you can get very good access to it. And if there's spillage of pus, anything under the diaphragm, you can wash out the whole tummy from top to bottom, right down to the pelvis. It is especially important in girls where you want to check that there's no pus nearby to the fallopian tube, where if there's pus around the fallopian tube, they can cause scarring and potentially problems with fertility in future. That's why having access with the keyhole technique allows you to do precise surgery and to do a more thorough job, especially when there is perforation. With better visibility and accuracy, you'll be able to take out the whole of the appendix without damaging any other structures, and making sure that the whole of the appendix is taken out.
What happens if the whole appendix is not removed on the first surgery?
So I've come across one particular situation where the whole appendix wasn't taken out, and this was done by someone else by the open technique. And because the visibility wasn't good, the visualization of the whole appendix wasn't complete, and therefore part of the appendix was remaining, and the child had the recurrent appendicitis, which then came to me, and I had to remove the remaining appendix by the keyhole technique. In that situation, I was able to see what was remaining and making sure that all the other structures were safe and was not damaged. So in addition to that, the cuts are smaller, there's less pain for your child, and recovery is fantastic afterwards. In fact, they'll be walking around almost immediately after the procedure if you do a keyhole technique.
Fantastic. Thanks, Doc. Yes, it sounds like there's some clear benefits to keyhole surgery over open surgery. You were mentioning about the recovery being very fast, right, compared to open surgery. Could you relate a story about perhaps one of your patients who underwent open surgery with you for appendicitis, and what was that story like?
Yeah, so just recently I had a little girl who's about 10 years of age who came in with appendicitis. She was really scared just before the procedure, and it was clearly appendicitis, but it wasn't perforated. And she was really worried from the beginning because she had the athletic meet 10 days afterwards. The story is interesting because she was so happy afterwards that she wrote me a note. And basically she had appendicitis, and she had a perforated, she had the operation for the appendicitis the same evening, and she was able to go home next day. I did a standard procedure where there was small cut in the belly button and 2 other small cuts on the tummy, and the appendix was removed without any issue, and fortunately it wasn't perforated. And she recovered almost instantaneously. What's interesting is that 10 days later she went on to compete in the inter-school athletic meet, and she won 4 gold medals, and she sent me pictures of how she achieved that. That was interesting and quite inspiring how she managed to do that.
Absolutely. So she came in, when she came in with her mom, you performed the operation on the same day itself?
That's right, yes. So once we confirm that's appendicitis, it's best to perform the surgery almost immediately.
Right, right. And she came in and she was discharged how soon after that?
So almost within 24 hours she was out.
Wow, and then 10 days later she ended up winning medals at
That's
her,
right, yes.
at her sports.
That's quite impressive, yes.
Awesome. Thank you, Doc.